The other is a 32-year-old nurse from the Ipswich Hospital known to have had contact with COVID-19 positive patients. I can confirm that yesterday on Russell Island we tested 152 people. Given the population of Russell Island is about 5,000, that's a very good, swift response from the community there, and we thank them for that. We'd urge them to continue to monitor their health very closely, and if they have any symptoms whatsoever, to go and get tested. The pop-up fever clinic will be open today. The MARTA has a testing clinic there open today. They also have a clinic on Macleay Island that will be available to them. I must say how disappointed I am to see that the LNP in Redlands was breaching the COVID restriction rules on the very day that we confirmed a positive case had been in their community. I want to turn to Ipswich Hospital, which has borne the brunt of this outbreak, this most recent outbreak, which now stands at 33 cases. 4 of those cases, as of today, are staff members of the hospital. 222 staff are now in quarantine as a result of their contact tracing of those 4 staff. 27 of the staff of the emergency department who had contact with that first woman from the Brisbane Youth Detention Centre have all tested negative and are back at work. But with more than 200 of the hospital's staff in quarantine, that has an inevitable impact on the rostering at the hospital. And so in order to be able to keep our health staff safe, a number of appointments scheduled for this week at Ipswich Hospital will either be relocated to other services or rescheduled. And I would just apologise to those patients whose appointments will be disrupted, apologise to them, but also explain that the reason we are doing that is to keep them safe and keep our hospital staff safe by putting them in quarantine as we have to. Today we've seen a senior LNP frontbencher, John Paul Langbrook, come out and call for Queensland's borders to be reopened. This is in defiance of the supposed claims by the LNP leader that she supports our strong border stance. Well, you can't pretend to support our strong border stance and have every other senior member of the LNP out there criticising us and attacking us. You can't have it both ways. It has to be one way or the other. So if John Paul Langbrook disagrees with Deb Frecklington, then Deb Frecklington should have the guts to sack him from her front bench. Otherwise, he is really just calling out the truth of what we know, and that is that the LNP does not support our strong border stance. We're also announcing today that the Queensland Ambulance Service will begin bolstering our testing efforts for COVID-19. We've learned throughout this metropolitan outbreak that we need a greater and more flexible ability to stand up more fever clinics quickly and do more testing quickly. And so while our first response will continue to be our hospital and health services and of course our private pathology services who have been fantastic also, we will begin using our ambulance service where we need to in order to be able to make testing more convenient for people, and that will begin hopefully shortly when we start making more testing available throughout those southern Moreton Bay Islands and the Redlands. So I'm just going to ask Kim Richards to say a few words about how the Redlands community is feeling, particularly those island communities. We've got Peter from the ambulance service to talk about how they will be assisting more in our COVID-19 response, and of course I should acknowledge that they have been crucial and vital and central to our response so far, and then of course the Chief Health Officer is available with much more detail.
Thank you, Deputy Premier. I'd like to thank the Deputy Premier and Queensland Health for their rapid response yesterday on Russell Island to the news of the active case. At 3:30 yesterday afternoon, they commenced testing, and as the Deputy Premier stated, over 150 tests were completed. I'd like to congratulate my community on their calm response and their responsiveness to being tested. It's been terrific. Our frontline services have done an amazing job. Our SES yesterday and our Redlands Coast Champions also did a fantastic job in supporting the Metro South Health team. So it's been a terrific response. I encourage all Redlanders, if you're feeling unwell, please make sure you go and get tested. The flexibility that's being applied to testing, and particularly on our unique and beautiful Redlands Coast Islands, has been fantastic. It's been rapid and it's been dynamic. So again, I thank the Deputy Premier for all of the work that's been done to support my Redlands community.
Queensland Ambulance Services happy to utilise their expertise in improving the capacity to getting the community tested in the outbreak of COVID-19. We wish to ensure that the community has rapid access to these testing clinics, and we want to maintain that people should get tested, maintain their 1.5 social distancing, and ensure that they're utilising hand washing techniques.
Well, good morning. So we've seen a really good response over the last 24 hours. So we had that case yesterday, a lady who lives on Russell Island, and I want to commend her for her response. So she has, after hearing all the messages about if you can't social distance, wear a mask, she's been doing that, and I'm sure that will stand that community in good stead. It is really important for the next week at least that anyone on Russell Island who develops any symptoms at all comes forward immediately and gets tested. We saw 152 people do exactly that yesterday. That's excellent. We need to see people over the next week, if they have any symptoms, come forward to that clinic that has been stood up. A number of other clinics have also been stood up, similarly on Macleay Island, just in case people from there, of course, have visited Russell Island. But it's really important that anyone with any symptoms comes forward and gets tested. Just as we work through this current cluster of cases related to the Brisbane Youth Detention Centre and the Queensland Corrective Services Academy. So we've had another 2 cases related to those clusters. In both situations, the people involved have been close contacts. In one, it's a household contact situation where someone has been living in a household where one of those Staines Memorial students live. So that's a clear transmission within a household. Then the second case is one of the nurses at the Ipswich Hospital who's been looking after one of those known cases in the hospital. So we know where those 2 cases are from. It's very, very important that people, when they are close contacts, do quarantine, and that's what we're seeing happening. So now we have 222 of our staff at the Ipswich Hospital in quarantine, which does mean there is some pressure on the capacity of the hospital, but they're managing that absolutely brilliantly. There will be some changes, but people don't need to do anything. If there's a change to their care that's needed, they need to be referred to another facility for an operation, for instance, they will get a phone call. People don't need to worry. If they haven't received any phone calls, they should just progress with whatever care they were needing. And of course, anyone who needs emergency care, the Ipswich Hospital is fully open for emergency care. No one should delay that. We know that delaying your health care in an emergency situation can lead to bad outcomes, so there is absolutely no need to do that. All of these are situations that we've planned for. We're now 8 months into this pandemic. We've had an enormous planning process, and all those plans are being utilised now. We are in a very different situation to what we were in back in March. We do now have plans, so people need to follow those plans. If they're unwell, they need to immediately get tested, and thank you very much to the QAS who are going to assist us in being able to put out even more clinics when they're needed and to rapidly respond. If you're unwell, get tested. Maintain that social distancing, 1.5 metres, using hand sanitiser or washing your hands. That is critical. If we all do that, as we're seeing people doing when we talk to them about the contact tracing we need to do, that is absolutely critical. and then make sure that you follow the COVID safe plans. I know businesses are working very, very hard to adhere to those COVID safe plans. We all need to do that. And we do need to minimise the numbers of people in our homes, because that is where we're seeing transmission happening. So really and truly, maximum of 10 people in your home, unless you live outside the southeast corner where you can have up to 30. Thank you.
Dr. Young, these 20 cases today, were they in isolation?
One of them definitely was, yes. We're just working out the contact details.
Do you have any
The other.
concerns over their movements in the past 2 weeks?
Not for that one. She's been in isolation. We're just doing some further contact tracing for the nurse.
What about the second one?
Yeah, the first one who was at home because their sibling was one of those early confirmed cases in Staines Memorial College, and we are seeing continued spread within households, although that spread happened, I believe, before we knew about that confirmed case in that Staines Memorial College student. So it's not happened subsequent to that. It's disappointing, as always, and I understand a number were fined. I know police are taking these protests extremely seriously. I just wish the protesters would take them as seriously. This is really important. It would be awful for a small group of people, and I understand it was a relatively small group, to undo the work done by 5.1 million Queenslanders. So really and truly, this is not the time to protest. We can protest differently today. We're not like in the last pandemic. Back in 2009, we didn't have the social media and the internet ability that we've got today. These protesters could protest online rather than coming out and risking everyone else's health.
How old is the sister of the contact? Is it a child?
She's in her 20s. Yeah.
And with the, I guess, this news of another nurse contracting it, do you have concerns about how they're dealing with patients and if they're using PPE appropriately?
No, I don't have concerns about the PPE, and I don't have concerns about the training. This is just such a difficult virus. It really is quite infectious, and we're seeing that time and time again. And we know from all of the cases that have happened in Melbourne, there's been large numbers of healthcare workers. This is a difficult time for our healthcare workers, and I'm extraordinarily grateful to every single one of them for the care that they're providing day in, day out, at risk to themselves and their families. So we've put in as much as we can to support those healthcare workers. For instance, if healthcare workers don't want to quarantine at home with their families, we organise for them to quarantine in hotels. So we had that with that group who came back from Melbourne. A number of them chose to quarantine in hotels, at our cost, of course, not at their cost. So we're working with them about what is best for them and their families. But this is a difficult time for our healthcare workers.
And to clarify, you believe that she got the virus or someone that came into the emergency department?
No, one of the people is being treated in a ward.
What do you make of calls for borders to reopen, and how likely do you think it is that Queensland will open up after Christmas? What would you like to see?
It would be fantastic if we could open up by Christmas. It would just be brilliant, because that would mean that New South Wales and Victoria have their cases under control. We're doing everything we can to assist those two states, and they are doing a marvellous job. They really are. They're getting on top of each case and contact tracing and managing them, but they've just got so many to manage at the moment. We can see here in Queensland, I think that all of our cases are most likely, I don't have definitive proof, but are most likely to one of the 3 young women who went down to Melbourne. And look at the amount of work that is taking for us in Queensland. So you imagine the amount of work that both New South Wales and Victoria are having to do today. But they are doing it, and they are doing it exceptionally well. So I am confident that with all that work, we should I hope, be able to open our borders for Christmas, because I know people want to get back together with their families. They want to share Christmas with their families, and Australians are very mobile people. We know that. There are Australians with families scattered all over the country. So yes, that absolutely is what I would love to see happen, and we will do whatever we can to help Victoria and New South Wales have that happen.
When do you expect to give the next advice to the Premier about what we should do?
So we do that formally at the end of every single month, and we work that through, but essentially the Premier is getting advice every single day about what is happening in those southern states.
Have you had anyone consider the hotspot definition?
Yes. Oh, definitely, yes. So we've been working for quite a while at AHPPC about what it means and how best we can explain it and manage it. There are a lot of issues. Hotspots depend about what you want to use them for. So it's really, it goes into a lot of detail, and there are so many different variables that need to be considered, and it changes. The hotspots that we're looking at today are totally different to the hotspots we were considering back in March, because back in March it was all due to importation of cases from overseas. Now it's all due to local cases. So it's a difficult process, but we're continuing to work that all through together.
Do you think it's inevitable that there will be more healthcare workers that are infected with COVID?
It's not inevitable, of course it's not. We're working to make sure it doesn't happen, but there is a risk that it will continue.
And have you, I guess, done a bit of a debrief as to how that might have occurred, how the transmissions happened? Do you know how it did happen?
No, that's being worked through at the moment for all 4 of those cases, to just work out how it might have happened and see if there's anything we can do to make it less likely in the future. But we've just got to remember that Victoria has seen well over 1,000 cases. So we've seen our cases here, and every single case we regret, of course we do, but we will work through if there is anything more we can do.
Can you let us know, I know you said you're still working through the contact tracing, but what general area that nurse had been in when you thought she was infected?
Yes, we thought it was the paediatric ward, so we've already worked very, very closely with the Children's Hospital, and they're now providing care to children from that area. So that's all happening and in place, and has been since we knew about it.
Will there be an updated list on places that people need to
Of course,
Yeah.
yes.
When do you expect that?
That'll come through as soon as we've got the contact tracing underway and we've got any more details. But we've got to remember that the Staines Memorial College related case, we don't believe that individual was out in the community. We just need to double check and go through all that. We always double and triple check everything, but at this stage we don't believe there'll be any additional information needed for that case.
And just to clarify, sorry, so she was working in the paediatric ward in Ipswich Hospital?
She's had contact with staff working in the paediatric ward.
So how many staff have had to isolate or quarantine as a result of this one?
So far we've had a total of 222. I don't know the breakdown for the individuals. Right, we have the first round of testing for those 44 residents who are actually in the facility at the time, and they're all negative. We're about to do a second round of testing on those residents, so that'll come through. At the moment, we're still going through all of the staff.
The nurse in this case, do you believe that she stayed at home from when she was sick, or do you think that she may have been in hospital while she was symptomatic?
She's been excellent, so I'm confident that all of that's in hand.
Premier, can I just ask you the budget update expected tomorrow? Has there been any recovery, or are we expecting?
I don't think you'd expect me to provide any of those details today. That'll be the Treasurer's job tomorrow.
Just as an overview, though, are we expecting to be spending or anything that is
The Treasurer will have all of that to outline tomorrow. I mean, obviously, Queensland hasn't been immune to the global pandemic or the global economic repercussions. Obviously, some of that detail will be outlined tomorrow. Much of that detail will be outlined tomorrow. I think what we've seen in the federal government's own figures released last week was that Queensland performed better than other states, particularly better than those states that haven't closed their borders, haven't kept their communities as safe from COVID-19. More of those figures will be available tomorrow.
How will the QAS and paramedics be actually helping with these testing centres?
So I'm happy to let Peter talk to that in a bit more detail, but essentially what we saw in the recent metropolitan outbreaks was a need to stand up fever clinics quickly and a desire to have as many as we can to make it as convenient as possible. You'll recall those days where some people had to wait 4 or 5 hours to get their tests. Well, we just don't want to see that happen again. The QAS is a statewide service, a flexible resource that we can move around that is highly mobile, clearly highly mobile, and so that it makes sense for us to deploy them to bolster our testing capability. Did you want to add to that, Peter?
Yes, if you could just explain, I guess, exactly what QAS will be doing with testing,
So QAS will be training up approximately 50 paramedics to be able to maintain clinics and increase the accessibility to the community to be able to provide COVID testing in that space.
Will your paramedics go into existing centres, or will you create your own sort of centres?
No, we'll create our own. We'll be able to utilise the infrastructure that we already have through our emergency management unit and be able to stand up and scale to whatever's appropriate in the time that Queensland Health identify that we need to.
So is that like at ambulance stations across southeast Queensland, or what sort of areas?
Depending on where the hotspot is or where our cases have been identified, we'll be able to scale up wherever we need to. So we'll be utilising car parks, schools, anything like that that we can help and assist.
Thank you.
No? All good? Everyone's happy? Very good. Thank you all.